Hello and welcome to Voice of Rio Grande. I'm Dr. Donna Mitchell, Dean of the College of Professional and Technical Studies, along with my co-host, Dr. Heather Duda, Dean of the College of Arts and Sciences. Hi, Heather.
Hi, Donna. How are you?
I'm well. Boy, it's been a busy week.
Oh my goodness, and it's only Wednesday.
I know. Students are back.
One of the things I've noticed lately, and maybe you have too, is the energy that's been on campus. I don't know what it is, if it's just that school's in session, everyone's excited, but I feel like the energy is so vibrant this semester.
The parking lots are full too.
Well, there's that. Maybe there's a lot of energy because people are walking more and they have to park farther away.
It's always great to see our students come back, our returning students and our new students. And I was here on Saturday and helped move some of the returning students back in, and they seem to be really looking forward to their classes and to school, or at least that's what they told me.
That's great. And you know, we had a welcome week last week, and I got to meet a lot of the new students, and they also were very excited to start their classes, and I think they really enjoyed meeting some of the faculty and staff ahead of time. Makes them a little bit more comfortable on campus.
They were a delight. I really enjoyed talking to those students.
I did too.
Well, we are very fortunate today because we have some special guests, and these are people who completed the DMS program, one of the 2 tracks of the DMS program, and they were actually award recipients. So our first guest is Lauren Mitchell, and she has completed her clinical components and her coursework, but I believe she may be staying with us at Rio for a while.
Yes.
Welcome, Lauren.
Thank you.
Hello.
Hi.
Give us a little bit of background about yourself, why you came to Rio, where you're from.
I went to high school at Benton County. I live in Wellston, just near Jackson County. I went to Rio Grande because I heard of the ultrasound program that Rio provided. They have an associate and a bachelor degree. And that's something that I was really interested in doing. Other schools didn't provide that. Rio is also very close to my home, so I was able to stay at home for a little bit and I didn't have to leave. But yeah, the program offered a lot of insight and a lot of clinical components that really helped me whenever I got my job.
What made you choose ultrasound as your major?
2 different reasons. My grandmother had an ultrasound appointment for her kidneys, and they found a mass on her kidney. They found it before it got, before it was too bad, and they were able to assess it, and she was fine. And then my baby nephew was very, very premature before he was born, and they found that with ultrasound as well, and that's just something that I thought was amazing, and they were kind of my family's saving grace, so I wanted to be that for someone else too.
That's a wonderful reason to choose a profession. I guess you were guided by your heart.
Yeah.
I think that when students have that sort of personal connection to their profession, it really encourages them and impassions them for the field. Did you find that once you got into your coursework that passion remained for you?
Yeah, absolutely. Between the work and the clinical, it's really, really hard, and it's difficult communicating with different patients, but there's always that one patient that really makes everything worth it. So.
And what are your plans as far as working? Do you plan on getting a job in the area?
I'm currently employed at SOMC in Portsmouth as a general ultrasound technician. I plan to pass my boards and become registered, and I hope to become a cardiovascular tech in the near future.
Did you find that your curriculum here at Rio prepared you for your current profession?
Yes, absolutely. We were required to take a lot of clinical hours, and the curriculum was very tough, but it was doable, and with great professors and clinical coordinators, it really made my first day on the job, it just seemed easy, honestly, because I was very well prepared.
That's wonderful to hear.
And if I'm not mistaken, you have chosen to do both programs. So you have a certificate, or you've completed the general program, and now you've completed the cardiovascular program. Is that correct?
That's correct.
So you could do ultrasound for actually any type of patient, depending on where you're employed.
Yes.
And are you finished? Have you left Rio now?
No, I still have another year to get my bachelor courses and some honor requirements to finish out, and then I will be finished, but with my bachelor, that is.
What made you decide to go on and do the bachelor's degree?
Honestly, because there's just more opportunity for me. With an associate, there is so much that I can do, but with a bachelor, there's just a wide variety, and I want those options and I want opportunities. So.
And in addition to being in the DMS program, I understand you're also in the honors program.
Yes, I am.
Is that something you would recommend to other students?
Yes, 100%. Being an honors student has really just broadened my education, and it really, as a student, it has made me, it's made me a stronger student. It's made me definitely better educated, and it's challenged me, that's for sure.
Do you have a favorite moment from the honors program?
Well, when I was in clinical, it was hard to take all my honors requirements, so now I'm taking a lot more than I have in a semester. And to be honest, I'm really excited about my Charles Manson honors seminar, so I'll be excited to see how that goes and what I learn about that.
That does seem to be a very popular class this semester for honors students.
Sounds a little creepy to me, but
Yeah.
You will definitely learn something you didn't know before, I'm assuming.
Yes, that's the plan.
What would you say to other students who are contemplating coming to Rio for the ultrasound program?
I would 100% recommend the ultrasound program to people who are considering it, just because we are very well prepared in the hospital setting, because we have clinical 3 days a week for 2 semesters and 4 days a week in the summer semester. And not only that, but our curriculum and schoolwork it's hard, but like I said, it's very doable, but it's like I would learn something in class and I would go to clinical and I would see it. And that type of doing the work and then going in a hospital setting, it really made things click for me. And I 100% think that, I know that Rio is the reason why I am a good ultrasound tech today.
That's wonderful to hear.
It is, and I've actually run into our graduates in Columbus. We have a graduate that was working at a cardiology practice and another graduate who was applying for lead technologist at Riverside. So our graduates are not only in our 4-county area or 5-county area, but they're also throughout the United States, not only in Ohio, but in other states as well.
Yes.
So that bodes well for our program and in the job opportunities.
Yeah,
I
absolutely.
have another question about job opportunities. Was it hard to find employment in the ultrasound field?
I assumed that it would be, because that's what I've been told, but a former student of mine recommended this general position at SOMC. I went in and I interviewed, I had my scan interview, and I waited and I was able to get the job before I was even done with school. So there are people hiring, there are people looking, and a lot of places that I've been to clinical, they would rather have Rio students.
And I know that the class that graduated, I believe it was a year ago with general, all passed their physics boards.
Yes.
So that's not an easy feat.
No.
I've been told, I've never taken physics boards, but I've been told that that's a difficult test.
It is. It was definitely a lot of blood, sweat, and tears, but I got through it. We all got through it. So we wouldn't have been able to do it without Laura Lee, our physics professor and clinical coordinator. So.
I know she was very excited and very proud, as were Stephanie Saunders and Carrie Denny.
Yes.
They even announced it at the pinning ceremony. And you received an award at the pinning ceremony. Tell us about your award.
I got the award of a multi-specialty award, and that was just because I'm a returning student and I've been through clinical and classes for not only general ultrasound but for cardiovascular as well.
What did it mean to you to get the award?
It really meant a lot, because we were required to have clinical 4 days a week, but since we're returning students, we would come 2 days a week back to Rio and we would help teach the new students, which is really hard, trying to teach somebody a new task that they've never done before in their entire lives, and help them recognize anatomy, normal anatomy, to get them ready for their clinical setting. And it really did mean a lot, because I worked really hard. Being a second-year ultrasound student, so it meant a lot.
And do you remember those days when you were that student learning how to do those skills in the lab? Did that help you maybe be more understanding with these new people?
It did, because they would look at me and I would say, okay, so this is so-and-so. Do you see it? And they said, I have no idea what I'm looking at. And I said, I understand. So I did understand where they came from. It was a helpless feeling, but it's a feeling where you think you're never going to get it, but you do.
Well, we appreciate you spending time with us today, Lauren, and telling us about the DMS program and your award. And congratulations on your job and finishing, and good luck with that Manson course.
Thank you.
Thanks for visiting.
Thank you.
You know, one of the things that I really liked that Lauren just talked about was the idea of theory and practice for our students, that you learn the theory behind what you're doing, you get that sort of in-classroom experience, and then you get the hands-on experience. How important is that in the field of health, do you feel?
I think it's critical, and it reminds me of 4-H, and this may be a corny example, but our motto was learn by doing. And I see that so much in my technology fields, my nursing fields, and my allied health fields, that they go to class, they learn how to do something or learn about something, and then they actually go, whether it be in the industry, into their labs, into their clinical sites, and have hands-on experience. So it brings it all together, and I'm a doing person. If they tell me about a new IV pump, I can read the manual, but until I have my hands on that pump and that tubing, it doesn't make sense. And so I think this is such a perfect opportunity for our students.
Well, I do too.
We have another guest. Welcome.
Hello.
Would you introduce yourself, please?
I'm Danielle. I live in Jackson. I did the general sonography program, and it was my favorite, and I just loved it.
What made you decide to come to Rio Grande?
I had already been to Rio when I was fresh out of high school and took nursing, and it wasn't for me. So I had one kid, and I knew I needed to do something to better her life. So I came to Rio, and then I found out I was pregnant with my second child, so I had 2 reasons to do it. And I had been to Rio, I was comfortable with Rio, so I came back.
Those 2 children can be very big motivators.
Yes.
Absolutely.
And what a great role model for those children
Yes.
to see what mom did.
Yeah. It'll show them the possibilities that they have as well.
Yeah.
We're going to have to take a little bit of a break, Danielle, and just give a moment. We'll be back in about 5 seconds or so. So we'll see you in a minute.
Okay.
Hello, we're back with Voice of Rio. Donna and I are here interviewing Danielle. And Danielle, you just graduated from the DMS program, correct?
Yes.
And can you tell us a little bit about maybe a highlight of that program for you?
I loved the clinical experience. I loved the hands-on with the patients. I was so happy to go every day, and I can't wait to start that as a career.
That's when you know you're in the right profession, is when you absolutely love what you're doing.
Yes.
And you look forward to going rather than dread.
Yes,
the
I
day.
loved it. I couldn't wait to go. I was like, I love this. This is what I want to do every day of my life.
Where did you do your clinical component?
I was at Adina, and I was at Holzer.
So you get to see more than one hospital, more than one way of doing things.
Yes, and I had very good clinical instructors there.
And how does that work at the hospital? Does your clinical instructor, is that somebody from the school, or do you work with somebody at the hospital?
Well, Laura Lee's our clinical instructor, but then we have all of our techs that teach us how to do everything in the hospital environment.
So you work side by side with a tech
Yes.
in the hospital.
Was there a challenge without, I know you can't divulge specifics, but was there anything that you found challenging about your experiences? Anything that you can share?
It was all challenging at first, and then it was rewarding when you finally it clicked, and then you could just do it.
Oh.
It was all very challenging because you didn't know what you was looking at first, and we were clueless, so they really taught us a lot.
And you feel much more confident now?
Yes, much.
Wonderful.
Where do you hope to work?
I have my application in a few places. I've had an interview, so I'm hoping to go back to Adina.
Wonderful.
I'm hoping they have a position that will be opening up, so hopefully.
That's great.
And that's good to know that there are positions out there, because I think one thing that's important for people to think about when they go back to school is not only this is what I love to do, but I need to make a living and pay back student loans.
Yeah.
So I need a job. So knowing that
Definitely.
there are jobs in the area is really good, because our previous guest mentioned that she's already employed. You have an opportunity at Adina.
Yeah.
You're interviewing there, so we know our graduates can get jobs in the field.
Yep. It's nice. And it's nice knowing, like, your previous clinical sites, if they're going to need help and when it'll be available, because they know how you work there, and they know that you know the protocol and you know everything that you need to know.
It sounds like your clinicals provided you with a nice networking opportunity for your transition from student into full-time professional.
Yes, they have. I had great sites.
And you did the general
I did.
program. So what type of ultrasound does a general sonographer do? What do you look at?
We can do everything from thyroid, breast, babies, liver, pancreas, kidneys, anything in the general aspect of it.
So you just don't focus on cardiovascular, heart, that kind of thing?
No.
It's just everything else? Do you have
Just when we see a heart on a baby, that's it.
no desire to do the cardiovascular?
No, not for me.
You know what you like, and you did the right thing.
I watched an echo once and I was like, nope, that's not me. I chose the right part of this.
Well, that's good that you're where you want to
Yes.
be. Now, do they sometimes specialize? Like, do some people just specialize and do OB?
Yes, you can do OB, or you can specialize in breast, or you can specialize in just general abdomen. So, yeah, you take your boards in different areas.
And so it's my understanding you may have to take a variety of boards.
Yeah. You have to pass physics, and then you have to pass another one to be registered.
And I'm sure that's not an easy task.
No. I'm studying right now, so hopefully I get those passed soon.
When will you take them?
I haven't set a date yet. I just want to be sure that I'm fully prepared and then go for it. 'Cause
That makes sense.
yes.
Yeah.
Good strategy.
Yes.
Well, thank you for joining us and being our
Thank
guest
you.
here on Voice of Rio, and we wish you well in the future, and I hope you get that job at Adina, and maybe we'll
Thanks.
see you at the hospital there someday.
Okay.
That would be very nice to see one of our students out and being successful in her profession.
Yes. Thank you.
Thank you.
Thanks.
And you know, Heather, that makes me think that I can't go into a hospital without seeing some of our graduates. It's either a rad tech graduate, a respiratory therapy graduate, an ultrasound graduate, a nursing graduate. They're everywhere.
Yes, they are.
And my mother's in the hospital now, and one of the nurses came in, and she was one of our graduates. And my mother said, everywhere you go, you see former students. And I think that a lot of our students do want to stay in the area.
Yeah.
And so knowing that there are opportunities in the healthcare field, almost in their back door, is pretty awesome.
Absolutely, and I think it speaks volumes to the high quality of our program. We have excellent programs, and that's demonstrated by the fact that local employers want to hire our graduates.
Right, and I don't think we've mentioned that our DMS program is accredited, both the general and the cardiovascular. They're two separate accreditations, and they maintain those accreditation standards. So that means that not only are they a program, but they're a quality program.
Yes.
Meeting the standards that are set at a national or international level. We have one more guest with us. Hello.
Hello.
Hi.
Thank you for joining us.
No problem.
Could you introduce yourself and tell us a little bit about yourself?
Yeah, my name's Andrea Hunt. I am from a small town in western Ohio called El Dorado. And yeah, this is my 4th year here at Rio as well.
So are you doing a bachelor's degree then?
Yeah, I finished the same year as Lauren, and I'm also taking extra classes to finish up my bachelor's degree.
And what made you decide to do the 4-year program?
I'm from like a really small area, and a lot of the hospitals there, like they do all their echoes together, and they do their general departments are all together. So they do like multiple specialties, like at the same place in the same department. So I thought it'd be like good to widen my like just widen what I can do, I guess.
That makes a lot of sense professionally. That was good planning on your part.
And it sounds like
Thank you.
maybe a necessity if you plan to go back home to practice.
I would like to go back home if at all possible, but I'm willing to move because, I mean, I'm new, so whoever's going to hire me, I'm like, okay, let's go for it.
Jump out there and take a chance.
Yeah.
I like that spirit of adventure.
I do too.
Thank you.
So what kind of classes are you taking now since you're done with your DMS classes?
Well, right now I have to take my probability and statistics. I have to take healthcare management. I have a history class, just like my prereqs that I didn't take while in clinicals because I didn't want to be overwhelmed with all my classes and all my studying.
And you're an award recipient as well.
Yeah.
I forgot to ask our previous guest. I know she was an award recipient too, so I apologize for that. Tell us about your award.
I got the same one as Lauren, where I'm a multi-specialty award winner. So I can do the general and I can do the cardiovascular exams.
Do you have a preference?
When I first started, I liked the cardiovascular a lot, and I feel really comfortable in both, and I haven't gotten to do like echoes in a while, but I really don't think I have a preference over one or the other. I think it's nice to have a big variety of them, so I like how I can do kind of all of them, if that makes sense.
That's great. You know, I heard this term used a couple of times now, echoes, and as somebody who's not coming from a health background, can you explain that a little bit more?
With echoes, we basically just look at the heart. We look at multiple different views of the heart, and we check like valves, we check the ejection fraction, which is how well the heart's squeezing and functioning, and yeah, after heart attacks or sometimes like stroke patients, there's people like that is who we'll look at.
That was a really good explanation. Thank you.
No problem.
Now, I know with cardiovascular you don't just look at the heart, so what other things do you look at?
Well, we can look at the carotid arteries, which are the ones in your neck. We look at arms, we look at the aorta, and we look at legs, and those are usually for like aneurysms or blood clots or something along those lines that needs a look at.
So that's why it's called cardiovascular.
Yeah.
Heart and vessels.
Yes.
What was a highlight of the program for you?
I think a really awesome thing in the program is how much of like a variety of places you get to go to study and learn, because if you're learning from the same tech and you don't end up working there, then you're kind of like limited to like that person, exactly how she does everything. So when you go other places, you get to learn more and get to, like, one person might know something and the other person not know it, so you get like a bunch of information from a bunch of different people, which I think is very helpful. And another one of my favorite things was the patients, because some of the patients are so sweet and it's so awesome to listen to their stories, and they always seem to give you like life advice, and I think it's kind of interesting to listen.
I definitely think you have to be a people person to work in the healthcare field.
Yeah.
And it sounds like
It
you.
makes a difference if you are.
Now with the different sites, do they have different types of equipment that you have to learn to use as well?
Yeah, like we have different types of machines. Like Philips is really common in this area, but we also use like, there's like Toshiba, and there's like other types of equipment, and all the buttons are different and all the controls that are different, and yeah, it's difficult to go from one machine to a different machine.
But going to different sites allows you to become comfortable with more than one product.
Yes, and you can put that on your resume, which is nice.
And makes you more marketable
Yeah.
and employable.
Absolutely.
What would be your advice to somebody thinking about coming to Rio for the DMS program?
My advice would have to be that basically you keep an open mind, kind of, because some of the places you do go to for clinicals aren't like the best, like they don't love to teach, and then other places you go to will really like to teach. Like I remember my first year I went to a clinical site that I wasn't a big fan of, and it made me just not want to do it anymore, but I stuck it out, and then the next clinical site I went to I loved, so then I'm like, okay, this is fine, I'm fine with this, so yeah.
gives you an idea of where you might want to work too.
Yeah, it does. It really does.
And where you mesh. Well, thank you so much for being our guest on Voice of Rio.
Oh, no
We
problem.
appreciate your time.
Thank
And
you.
we know this is a busy time for students with studying and first week of class and just diving in there and getting your books. And I imagine you were probably reading before you came to talk with
Yes,
us.
I was doing math homework.
Well, good luck with your semester.
Oh, thank you guys.
Thank you. Thank you for joining us for another episode of Voice of Rio Grande.
See you next time.